everyone, and welcome back to my channel, and welcome to a new episode of Psych Sesh with Effy. So if you don't know who I am, hi, my name is Effy, or Shujina. One's a nickname, one's my real name. You can call me either way. And I have created this series on my channel called Psych Sesh with Effy to talk about psychology and psychology only. So in today's video, we're going to talk about BPD, which is borderline personality disorder. And I decided to talk about this one because one of you guys left a comment in my latest video that you wanted me to do a video on BPD, so here we go. The term borderline was first coined by Adolf Stern in 1938 when he identified a borderline group of patients who fit frankly neither into the psychotic nor into the psychoneurotic group, and are extremely difficult to handle by any psychotherapeutic method. Borderline personality disorder as a mental disorder was first accepted in 1980 by DSM-3, and ever since its acceptance, it has stimulated both clinical and scientific attention. BPD is characterized by impulsivity, self-harm, suicidality, and emotional and interpersonal instability. As it says in the name of borderline personality disorder, it can be categorized as a personality disorder. So what are those? Personality disorders are long-term patterns of behavior and inner experiences that differ significantly from what is expected. The pattern of experience and behavior begins by late adolescence or early adulthood and causes distress or problems in functioning. It is also important to state that without treatment, personality disorders can be long-lasting. Personality disorders affect at least two of these areas: way of thinking about oneself and others, way of responding emotionally, way of relating to other people, way of controlling one's behavior. There are 10 specific personality disorder types that you can read all about in the link that I linked in the description box down below. So now that we can categorize BPD into one group, it being personality disorders, let's see what the American Psychiatric Association defines BPD as. BPD is characterized by a pattern of instability in personal relationships, intense emotions, poor self-image, and impulsivity. A person with borderline personality disorder may go to great length to avoid being abandoned, have repeated suicide attempts, display inappropriate intense anger, or have ongoing feelings of emptiness. According to the DSM-5, there is a lot of thought that goes into giving the diagnosis of borderline personality disorder to a patient because it is really complicated. But here are the list of things that a professional has to consider if they want to give a patient the BPD diagnosis. A. Moderate or greater impairment in personality functioning manifested by characteristic difficulties in two or more on the following four areas: identity, self-direction, empathy, and intimacy. And B. 4 or more of the following 7 pathological personality traits, at least one of which must be impulsivity, risk-taking, or hostility. And the 7 pathological personality traits are emotional lability, anxiousness, separation insecurity, depressivity, impulsivity, risk-taking, and hostility. So as we can see from the DSM-5 handbook, it is really complicated. The professionals have to be really specific when they give a BPD diagnosis to a patient. And of course, there are key elements that they are always looking for, such as looking at personal relationships, impulsivity, empathy, and these pathological traits that we just talked about. Borderline personality disorder seems to result from an interaction between biological, for example, temperamental and psychosocial factors, for example, adverse childhood events, and is associated with severe functioning impairment, substantial treatment utilization, and high rates of comorbid mental disorders, self-injury, and suicidal behavior. So from this citation, we can see that BPD has a high comorbidity, and what that means is that it is likely that a patient who is diagnosed with BPD would have some other kind of mental disorder as well. So what can we gather from all of this information? Patients with BPD would more likely have a really hectic social life, a really dysfunctional relationship, or any kind of partnerships. Suicide attempts are also really common, and suicide as well. And patients with BPD tend to be really impulsive at times. And although people with BPD long for empathy and a deep and meaningful relationship, most of the time they have a really hard time maintaining a stable relationship or partnership or friendship in life. Last but not least, what do we know about the treatment of BPD? Certain types of psychotherapy are effective for treating personality disorders, but the type of treatment will depend on the specific personality disorder, how severe it is, and also the individual circumstances. As much as we can talk about how one mental disorder could be treated and what do the studies say, what is effective in treating one mental disorder, it's always really important to keep in mind the personal aspects. It is also important to state that there are no medications specifically to treat personality disorders. However, medications such as antidepressants, anti-anxiety medication, or mood stabilizing meditation may help and may be helpful in treating some symptoms. More severe or long-lasting symptoms of BPD may require a team kind of approach, where a team works together with the family members, a psychiatrist, a psychologist, a social worker, and they work together to help the patient. A little more on the treatment of BPD, the Harvard Medical School says, borderline personality disorder is a challenge to treat, not only because it is complicated and stigmatized, but also because its symptoms reflect ingrained patterns of thinking and behavior. Many patients with BPD also have other mental health problems, such as a mood disorder or post-traumatic stress disorder. And last but not least, I have found some current studies from 2019 and 2020. Patients with BPD were over 13 times more likely to report childhood adversity than non-clinical controls, and emotional abuse and neglect were particularly elevated in BPD samples relative to controls. And finally, a study from 2019, which was really exciting for me because it looked at BPD from a lifespan kind of perspective. BPD first manifests itself in adolescence and can be distinguished reliably from normative adolescent development. BPD symptoms and impairments continue to wax and wane up to old age, and their expression depends on contextual and developmental factors. The course of BPD from adolescence to adulthood is characterized by a symptomatic switch from predominantly symptoms of affective instability and impulsivity to maladaptive interpersonal functioning and enduring functional impairments, with subsequent periods of remission and relapse of the full categorical BPD diagnosis. So what we can gather from this is, as most of the personality disorders, BPD is also a personality disorder which can have an effect on the patient's whole life with remissions. So sometimes the symptoms cannot be seen as much and the patient sometimes cannot feel the symptoms that much, but it can come back. So it's kind of like a wave, that's how I would describe it. But that's it for Psych Sesh with Effy episode 3 for today. Thank you guys so much for watching this video. I hope that it was helpful and somewhat insightful into borderline personality disorder. If you enjoyed this video, please don't forget to give it a like and subscribe to my channel. And if you want to see more from me, I also upload lifestyle and vlog kind of videos on my channel, so be sure to check that out. I also created a Patreon page, so if you want to support my channel and all my digital creator work, just click in the link that I will link in the description box down below. Please leave your comments in the comment section. Leave me ideas, what do you guys want me to talk about, what should we talk about in the next episode. I hope you enjoyed. Again, thanks for watching again, and I will see you guys in the next video. Bye guys.